Hello everyone, I am Dr. Mohan Rao.
I am Dr. Mugdha Rao.
Welcome to our fourth episode of our series Coping with Infertility, Mindfulness and Meditation Techniques for Infertility Stress. We at Dr. Rao's Center for Reproductive Immunology treat couples with unexplained IVF failures, repeated miscarriages, and unexplained infertility with the help of active immunomodulation in the form of our patented and branded process of Immulit. We see the pain in the eyes of the couples going through this journey, which deeply affects a patient's psyche. The emotional toll, fear of never becoming a parent, and social and societal pressures can be overwhelming. Seeking hope and emotional resilience becomes absolutely essential. Understanding this struggle is the key to providing compassionate care and support. Hence, we are planning this live series every Wednesday on how to navigate this journey with the help of a passionate mental health advisor, Dr. Akshata Bhat. Welcome, Dr. Akshata Bhat.
Hi, Namaskar.
Dr. Akshata Bhat is a consultant psychiatrist in Villeparle East. She has extensive experience across public and private sectors. She specializes in treating mood disorders, schizophrenia, and substance abuse while actively promoting mental health through workshops and social media. Dr. Bhatt is very passionate about raising awareness and ensuring mental health, especially in couples with reproductive failures. Today is the fourth episode. You can see the first three episodes on our YouTube channel, Dr. Raut's Center for Reproductive Immunology. Don't forget to like, share, and subscribe to our channel. Knowingly or unknowingly, you may help a couple complete their dream of having a family. So let us start the episode today.
So let's begin, Dr. Akshata. Our today's topic is about mindfulness. So, our first question here is, what is mindfulness and how can it specifically benefit the couples who are experiencing the stress of infertility?
So, mindfulness has been taken up by different philosophers, different religions. It has been explained in different ways by different people. Okay. So, if you go to read about it, you will see that there is a wealth of information about it. Today's session will be more about trying to understand a very few basic concepts that we can apply rather than going into the depths of the philosophy and everything behind it. So, in a very, very simple way, if you want to understand what mindfulness is, it means to be in the present moment. It means to be here now. So, this is where we are. Like I'm talking to you, you are talking to me, we are looking at each other and we are carrying on this conversation, and our focus is on this conversation. So, we are being mindful right now by carrying on this conversation. So, in a very simple way, be here now, be present, be in the present moment. That is what mindfulness is.
And then, what is its role? Means, do you think it is that topic what we are discussing is an important topic now?
Especially for patients with reproductive failures.
So, as we keep saying that this is a marathon, it's not a sprint, it's a long journey. And generally, when you will talk to couples who have infertility issues, they will tell you in months, years, how their journey has been. So, it's a long term problem that is happening. So, tendency for the human mind is we go into the past, we are filled with regret, we are filled with guilt. We think about the future, we are anxious. What will happen? When we think about the past, we think about all the things we've done, all the things we've said, and we tend to wonder, did I do right? Did I do wrong? What happened here? And this is what I'm angry or I'm sad about. When we think about the future, we think these are the things I need to plan for. These are the things, how will I do it? How will I plan for a family? How will I support them? How will I take care of my child? So the past is associated with guilt. The future is associated with anxiety. But when you are right now here in the present moment, you are where you are. There is no negative feeling associated with it. You're in the present moment, you're focusing on what you're doing, you're being mindful of what is happening around you. So this is how it will help, because your focus will be on today. In a lot of programs like Alcoholics Anonymous or Narcotics Anonymous, for example, the basic philosophy is one day at a time. It means that we cannot control every aspect of every timeline in our life. But what we can do is today. Today is in my hand. What I can do today is in my hand. So that is the concept here with mindfulness as well. The application is the same, that you can do something with what you have today.
See, usually when we talk about mindfulness, there is one more concept which comes to our mind or maybe any person's mind is about meditation. So
Yes.
is it same as meditation, or what is the difference between mindfulness and meditation?
So, meditation is a technique that you can use to practice mindfulness. You can use meditation for other things also. For example, with younger children, we generally teach them basic breathing techniques to help them focus. So, what happens is over a period of time, your attention span and your ability to focus improves. Same with adults. A very helpful and simple technique to do is to close your eyes and focus on breathing. Okay, so meditation can be considered a part of mindfulness. It can be considered an independent entity. Okay, now here I'll talk a little bit about meditation because I want to make it applicable for everyone. This should be something that we all can do on a daily basis. A lot of people think meditation means aankhein band karo and don't think of anything. Now, I think that's the most difficult thing in the world. We have a monkey mind. Your mind is never still. It is always thinking about 10,000 things. Like right now, also, when we are talking, probably, I'm sure I'll be honest, I'm probably thinking, what am I going to have for lunch when I go home? So we are thinking about a lot of things at the same time. It's not always possible to focus 100%. So one thing I want to advise people when they go for meditation is don't focus on doing it 100%. Just focus on participation. Don't focus on the success. It's more important to attempt meditating for 5 minutes per day than to do it successfully. Okay. Trying is more important than succeeding in these situations. So, a very simple way to meditate would be listen to a piece of very simple music, maybe instrumental, something that you enjoy, something that you're familiar with. Just focus on the melody. You can focus on the instruments. If there are vocals, you can focus on the vocals also. Each time, focus on a different thing. It becomes very difficult for a lot of people when you say close your eyes and don't think about anything. So I think it's easier when you say let's focus on one aspect of it. If you're listening to a piece of music, another simple way, this is a combination of mindfulness and meditation. They are very, very closely entwined. Okay, so focusing on your breath. When we say focusing on the breath, it doesn't mean just counting it. It means the sensation that you feel when you inhale and when you exhale. You can feel your diaphragm that is near your tummy. You can feel it moving. You can feel your chest moving slightly. Okay, or any other sensations in your body when you take a deep breath. You'll feel that your muscles are relaxing. So focusing on that is another simple way of doing meditation. It doesn't have to be very, very difficult. It doesn't have to be complicated. You can just find one thing to focus on and go ahead with that.
So this is about, I think you told about the meditation. So coming to mindfulness, are there any techniques of doing achieving mindfulness, or can you tell more about that? How can it be achieved, or how can it be done?
Okay, so one simple thing is what we generally tell people, that be mindful when you talk about something. So that means you're taking into consideration what the other person might think. You're taking into consideration what the other person might feel, how they may perceive it when we say something. Okay, or when we tell somebody be mindful of the time, be aware. So it's a way of telling somebody please be aware. It's a very nice way of telling somebody please be aware of the time, rather than telling people be on time. Why can't you be on time? It's a nice way of saying please be more mindful regarding being there on time. I think it's a very beautiful way of telling somebody please be aware of what you are doing. So in this case, what I would say is there are a lot of techniques. We'll do one or two very, very simple ones very briefly. The first one I already told you, the one where you focus on breathing. So you look for the movements in different part of your body, the sensations. Another one is called scanning. So in scanning, you just sit by yourself or lie down, close your eyes, focus on different parts of your body and what is the sensation. Even when we are passively, like if I'm sitting like this or if I'm lying down, there is some amount of sensation in every muscle, every limb, every part of your body. And generally, we don't take that into account. For example, I'm wearing a watch, but I don't know that I'm wearing a watch. You know what I mean? I don't feel it 24/7 ki watch hai mere haath mein because you're used to it by now. So here the idea would be to focus on the different sensations we feel, because usually we are preoccupied with the 100 other things we have to do when we get home or all the work that is pending. So here it would be just to focus on right now I've closed my eyes and I'm meditating. I'm focusing on what changes are going through my body. Okay. Another technique is mindful eating. This is a very good one and it's an easy one to implement for all of us. Most common scenario क्या होता है? End of the day, you go home, you pick up your plate, you have your TV on or you have your Netflix on and you're sitting there and eating. When you started eating, when you finished eating, क्या खाया, कितना खाया, nobody knows. Okay. So mindful eating would be a good idea here, which means you turn off your laptop or your telly, you sit by yourself or maybe with family, and the focus is on the food. For example, the most common example I always give is regarding looking at an apple. Now, how if you pay attention, usually क्या होता है, apple मिला, धोया, खाया, खत्म हो गया. That's it. Look at it. Feel the weight in your hand. See the fragrance of the apple that you get. Generally, apples, whatever the color is, it's not consistent. You'll see different flecks of white and yellow and everything all over it. These are things we don't observe if we just grab and bite into it, right? So here it would be you sit, look at the apple, see the color, see the texture of the outer skin, the fragrance. Once you cut it, what is the texture of the inside? The fragrance becomes more pronounced as you have it. Then when you bite into it, the initial slight tanginess and the sweetness of the apple. Okay, so here the focus is on using all your senses. The crunch that you make when you bite into it, that's where you're listening to it. You're perceiving the colors, you're touching the skin. So that is your sight and feeling. You're smelling the fragrance and then you're tasting it. So all your senses are focusing only on eating the apple. The rest of the world doesn't matter. अभी मैं apple खा रहा हूँ, मैं सिर्फ apple खा रहा हूँ. That is the simplest way I can explain mindfulness. That while you are doing a task, that is all you are doing. Okay. So mindful eating is also helpful because we have become more aware of what we are eating, how much you are eating. For someone who is trying to eat healthier, I would say it's a great way to focus on what you're eating. How much is it? What is the flavor? Am I chewing adequately or am I just shoveling food down? So I think it's a great technique. It helps you with in other situations as well.
We have always seen that patients who have infertility, they are going through a huge emotional roller coaster. Like on their face, when they're talking to us, you won't make out anything. But we know when we start probing more, we come to know about their ups and downs. So will this mindfulness and meditation help them to navigate this emotional roller coaster?
Starting your day even with 10 minutes of silence is a wonderful way to start your day, just to get the chaos out, just to start. So incorporating this on a daily basis, I think will be very helpful. There is a saying, I think I might have missed a part of it, that if you are busy, then meditate for 10 minutes. If you are very busy, then meditate for 1 hour. That's what it says, And it's a beautiful technique because what it says is that the amount of relaxation you should be taking is proportionate to the amount of work you're doing. Recently we've all heard in the news about people getting overworked and developing very severe health problems. Yeah. Okay. The parallel I can draw here is in both in infertility as well as in chronic work culture. It's a long-term process. It's a long-term stressful process that on a daily basis you are facing. So as we said, I remember saying in one of the previous sessions, eliminating stress is not possible. Every job, every role that we play has some amount of stress associated with it. We have to find a way to balance it out through exercise, through meditation, through being more mindful. For example, now even if today in the afternoon when you go for lunch or tomorrow when you go for dinner, if you start focusing only on the food and what you are eating, it is a much more amazing way to enjoy your food, rather than thinking ki what is going on, debate kaun sa chal raha hai, Arnab kitna chilla raha hai TV pe. Focus on what you are doing. It will give you a lot of joy. So the point of mindfulness is to focus on what you are doing at the moment rather than thinking about what will happen ahead or thinking about what has happened behind. And since infertility tends to be a long journey for a lot of people, it is very important to stay in the present moment, not think about when will it happen for me, or not think about this hasn't happened for me so far.
I think because this is the main problem when we tell them about this, say, meditation and all, they say, Doctor, we are so busy taking this medicine, that injection, visiting doctor, visiting sonologist, we don't have time to do all these things. But I think, as you said, even a small, short duration of this meditation and mindfulness, keeping mindfulness in small activities will also help these couples have the mental stability, I feel, what they miss during this treatment.
So what I will say here is that even a little bit is better than nothing. Even 5 minutes that you spend closing your eyes and doing some deep breathing is better than zero. Even 10 minutes of exercise is better than zero. So don't aim for I have to be perfect. Don't aim for I have to go to gym for 2 hours every day. Aim for I will exercise daily. This is more doable. It is like रोज जाके present ही mark करो. Don't focus on कितना किया है. Even 10 minutes of meditation is better than 0 minutes of meditation. Don't think of it as I have to clear my mind and do everything perfectly. That's not how real life works. So we have to be open and flexible to the idea that we can do a little bit, go ahead. Do a little more, go ahead. Build a foundation and then you build a building. We can do it gradually, step by step. That is what I'm trying to say here.
And during this treatment, many times they get some good news, but sometimes some stressful, bad news, failures. So at that time, I think use of this meditation and mindfulness will definitely help them to tide over the crisis also. What do you think?
So one of the things we talked about is breath work. Now here, breath work is one of the best techniques because in certain aspects of the treatment, you may not be allowed to exercise, for example. You may be asked for bed rest, you may be, or because of the injections and everything, you may be too tired or too sore to do anything. But breathing is something you can do sitting, standing, lying down. You don't have to dress in a certain way. You don't have to bring out a mat and everything. That is the beauty of breath work. There is no restriction. For example, with yoga or exercise, they will typically tell you that there has to be a gap between food and doing the exercise. For breath work, that is not an issue. You can do it anytime, anywhere, lying down, sitting, standing. You can do it when you are traveling in the local train also. The point being, it's very versatile. It's a versatile tool and with low investment or rather no investment, but a high return. So I would say this is a very good technique that we all need to do more frequently. Simple, deep breathing, simple mindfulness about where we are, what are the sensations. Simplest example, you go for a walk with music, the focus being on the music. You listen to a different aspect of it every time. Something like that. Like keep it simple, but be consistent. Consistency is very important. Rather than doing something perfectly, doing it regularly is more important.
So I think,
and as Dr. Mohan rightly said, that they are in for a lot of frustration also, patients of infertility. They have expectations of the treatment. It may not get fulfilled, or even if there is a pregnancy, it may end up in a miscarriage. And there is where their roller coaster would always be up and down, or they're expecting something, they have planned their life in a particular way. But here, I think then if they practice mindfulness regularly and meditation, as you've given so many things to do as a meditation form and bring you back to the now, that it seems very easy. Like even for us as doctors, it seems easy that, oh yeah, this can be done, this can be achieved. So it will definitely I feel will help them manage that emotional roller coaster.
And one more thing is, doctor, that many times we tell them, patients say we try, but it is not possible. So many times they face a lot of barriers, or maybe that's what we feel, that still there are certain hurdles they face in going through this and to do meditation or the mindfulness. So can you tell a little bit more about it, these barriers, why they have such barriers and how they can overcome these barriers? Because it is easy to tell you should take rest, you should meditate, but these barriers practically
Because we, as gynecologists, we will not be able to explain, but you understand the barriers better. So, as a psychiatrist, what would you think?
So a lot of people say that they find it very difficult when you are told close your eyes and don't think of something. So for someone like this, I will say, why don't you try guided meditation? Now, in guided meditation, you'll have someone giving you instructions on what to do. The most common scenario that we generally use is a soothing scene. It will be something beautiful, like you're sitting at a beach or you're walking through a rainforest or something like that. And the person who is giving the meditation will give a detailed commentary of what is happening around you, including the smells, the sights, the sounds. So that will help you visualize what is happening. So this is a very good technique for someone who says, I have a hard time focusing by myself.
So, do you feel that there is, uh, apart from the various medical treatments which are involved in infertility, do you feel that mindfulness and even meditation would additionally help these couples towards success?
So one more thing about mindfulness is how it would help is that it helps you stay more in the present moment. I know I keep saying this, but the reason I'm bringing it up here is in infertility, there is a tendency to think that I have been going through these treatments for so many years now. So every time you think about it, there is a part of you that is reliving it. Physically, the changes that happens is we are aware as doctors of the hypothalamus, pituitary, and adrenal axis.
Yes.
That gets stimulated again. If I have to explain it in very simple ways, you experience the same kind of stress repeatedly when you think about a difficult event. So here what happens is when we start thinking, now it has been 3 years, now it has been 4 years, this is how I started, this is where I was, this is where I am today. You tend to relive it, you tend to go through the same kind of stress. Your body feels the same kind of pressure, which can be spikes in blood pressure, it can be difficulty in breathing, irregular heartbeats, because that's when your adrenaline is pumping through your body. So this is like reliving the experience over and over again. So when you are being mindful, you're focusing on what today is, what right now is. You're not thinking about what has happened before. You're not thinking about what is going to come ahead. So this is going to help you in that way that you're not going to keep stimulating that axis and going into severe anxiety or spikes in blood pressure because you're reliving the same thing over and over again.
So definitely it becomes complementary to the medical treatment that they are taking for fertility, and it will help in the success of this treatment, because I think mental problems or stress does have effect on the body, and managing it with meditation and mindfulness will definitely help them. I think you must have come across patients like this who have this type of problem, and with the help of mindfulness or using meditation, they have achieved success, or they have become successful. They have got over their problem. So can you share some your experiences?
So mindfulness is a very good technique for dealing with anxiety, for dealing with depressive symptoms, provided they're in the milder side, okay, in the initial state. Of course, when it crosses a certain threshold, you have to consider medication, okay. As far as mindfulness is concerned, I've seen that people who practice it tend to feel more grounded. They're more realistic about where they are right now, they're more aware of their surroundings. They're more realistic. When I say grounded, I mean more realistic, more understanding of what is happening around them. And I think that's a great thing, having the awareness of where you are right now, being realistic about what to expect. These things, when we apply them to infertility treatment, having a realistic expectation of what can happen, having an understanding at what are the factors working for me or against me, being more aware, being more present is always, I think, very, very helpful. So in this case, I think for people struggling with infertility, being mindful of where they are, of where the journey might take them, I think it's a good place to start, being realistic about what your chances are, what are your expectations, how long it can take, how long can the wait take, how much time it can take for things to change.
So many times when we interact with our patients and discuss about their infertility problem, they come up with questions like, why this is happening to me only? Why at this time of my life? And so these type of questions make them more stressed or more anxious. So I think these type of patients, I think what you have just told, who will be benefited, these type of patients, it will be beneficial for them if they realize where they are, or as you said, they are more mindful of the reality. So then I think this will help them to get out of this spiral, because it takes them down and down, because they keep on thinking about the same problem rather than focusing on the positive aspect of the treatment.
Which is activating their hypothalamus pituitary adrenal axis, and which actually may become detrimental to treatment, to the medical treatment. So this part also, mindfulness should become a part of the medical treatment. So it should be complementary with just a gynecologist treating, a psychiatrist help to get to to being more mindful. Doing meditation is going to definitely help them not to relive their past.
So do you think if they are, say, in early phase of this stress or anxiety, and if they don't take care of it properly, say with mindfulness or meditation, like you said, it is helpful in the early stages, is it likely that they go into the next stage or more serious form of maybe depression or severe anxiety? So is that possible? So because many times we see these patients taking medication for depression. So these patients, if they take help of meditation and mindfulness very early in their problem, can it help to prevent go into this serious type of psychiatric or mental disorders? What do you think?
So, to be very clear, if it is clinically diagnosed depression, anxiety, or any other illness, it requires medication. There is no dispute from my side about it. Now, there is some preventive value here with using mindfulness, using a healthy lifestyle. Those things help. They may not always be curative, maybe in milder forms or for transient problems, which are at the moment, which are happening in response to a situation. Yes, it may be helpful. It may not be a curative for clinical depression or anxiety, but it will help in the outcome over there. So, along with medication, yes, I will always encourage everyone to try mindfulness, to try other techniques which help them. One of the beautiful things about mindfulness is it takes you on a path of self acceptance. That is the final goal, that you reach a point of acceptance of about the situation, about who you are as a person, and you work with what you have rather than thinking about what you don't have. What sir mentioned about the why me kind of attitude. I think at some point we've all had that. Whenever things don't work out, we all feel, यार ये मेरे साथ ही क्यों होता है? Why is this only happening with me? Why is everybody else doing so well, but I'm the one who's suffering? And depending on your mindset, those who are into religion and spirituality will give you different answers. For example, whether it is karmic retribution, you're getting something for what you did in your previous lives, depending on that. Some people will say it is a cause and effect. Some people will say कि ये तुम्हारे भाग्य में लिखा है, इसीलिए ये सब हो रहा है. So it depends on what, everyone has a different set of beliefs. Some people will just say this is what life is. This is what happens. You get what you get. That's it. So in all of this, irrespective of what your belief is, moving towards acceptance is always a healthy option rather than living in that denial, or living in that sense of blame and anger and frustration. It is always better to get to a place of acceptance, irrespective of what your belief system is, and everyone has a different way of looking at things. But people who generally have a very strong understanding of what reality is, who are very accepting of themselves and of other people, tend to do a lot better in life.
So one more thing, what we see in this infertility treatment is one of the partners is more stressed or more anxious. So is there any role of the spouse? So in helping the partner may be doing mindfulness or meditation together or something. Can you give some advice regarding that? Will that be beneficial for the couple?
So, a simple piece of advice for all families, for all couples, for anybody who is with someone or with a friend or with a companion, I would say take out time to sit and talk to each other every day. Try to have one meal with only each other, no devices, no TV, no cell phone, no laptop, nothing. Like the point is you are mindful. The focus is only on what you are eating and the person who is with you. So communication helps a lot if you are having a busy schedule, that which most working people do. Taking that little time out for your partner is a wonderful way of showing that you care about them, because time is valuable. When you are giving your time to somebody, it is a way of showing that I care about you. This is why I'm investing my time in you. So take out time to spend with your family, with your spouse, with your partner. Since the question was specifically about companion and partner, I will say please do that, and practice mindfulness in a very real way by being where you are, instead of you and your partner being in the same room but both of you are on your phones doing something. That's not helpful. Be there, spend time with each other, talk to each other, see how much you are comfortable navigating together. It's also completely fine to not be able to talk about certain things with your partner. Being in a relationship doesn't mean that you have to discuss every single thing at all times. You have to also understand whether your partner has the wavelength at the moment to talk about this. Do they have the bandwidth? Can they talk to you? Are they in a state of mind to have a difficult conversation? So having a little bit of flexibility regarding what the other person wants as well, and being open and clear about your communication and focusing on where you are right now. Very common thing is when we get into a fight with our partner, you did this last time, you did this 5 years ago, you said this to me 2 months ago. Everyone keeps a record. The problem is the attention then goes into that. You're not focusing on where you are right now. So, again, a good way to talk about mindfulness is telling the couple that when you fight, na fight about today's matter. Don't fight about old matters. झगड़ा करने का है आज के मैटर पे झगड़ा करो. Don't bring up old things and say you did this, you said this, you brought this up.
So I think that will play a good role in the life of couple who are facing the challenges of infertility, and mindfulness and meditation has a big role to play.
Yeah,
What
Dr.
would you-
Akshata, again, every episode of yours has been a learning experience for us also. And definitely it will help us to look at patients differently, to treat them differently. I'm really, really grateful to you to give us this time, to give us this time of yours to our viewers who will, I'm sure, benefit a lot from whatever advices you're giving in each episode.
They have already started telling us that they have seen the previous episodes, they have liked it, they have gained a lot of information from that, and they are eager to see the
We are looking forward to the subsequent
episodes.
episodes. So thank you once again. And viewers, don't forget to like, share, and subscribe to our channel. Knowingly or unknowingly, you may help one couple achieve a baby of their dreams. So we are here concluding, they're asking for only one share from you. Thank you so much.
Thank you so much.